with these disorders, we kind of converge different therapies. So yes, there's room for pharmacotherapy or medications, but then actually the mainstay is psychotherapy. And with psychotherapy, there are different type of therapies involved in there. So you have cognitive behavioral therapy. You might have also systematic desensitization based on the specific type of anxiety disorders. If there's a specific and identified trigger amongst others, based on the nature of it, then the psychotherapist would outline a specific line of treatment for the individual. But it's mostly psychotherapy, so it's not purely medications. However, as said, with the nature of how these things manifest and how it takes a toll on the body and how people can't function, sometimes there's a need to include some medications to help manage the individual. So we have different classes of medications that are used as well in managing them. And based on the individual, sometimes there might be need for other forms of therapy. So sometimes family, amongst others, as is needed for the specific individual. As said earlier, these are the most common mental health disorders that are experienced worldwide. So a majority of people go around experiencing these but do not know that there's help for them. Well, most people don't even know that it's actually a disorder that is recognized as a medical condition. And so they live with this experience. And as I said, it can be extremely intense and it can also have a lot of impact on one's functioning. And people go through life experiencing these recurrently, experiencing low socio-economic status, getting a drop in their productivity, it's affecting their family life, their home lives. With some conditions, there's even more. So for something like a social anxiety disorder, some research has found that even amongst men, persons who experience this to a high degree can have they can remain single, unmarried, or experience higher rates of divorce compared to other men. And then for some disorders like panic disorders, specific phobias, they have also been linked to an increased risk of suicide. So these disorders have some impact, there's some repercussion, especially when it's not attended to. The challenge is that most people do not know that there's help for them. They do not know that there's medical intervention for them. So they live thinking that that's how their life is supposed to be. That's what they are cut out to experience. That's their lot in life. We are hoping to inform and educate such that when individuals experience these conditions, they can reach out and get the help they need so that they can experience and live life to the optimum. So that's the reason. And just to add on, so just to reiterate what has been said, this anxiety or this emotion or this experience is something anybody might experience in the course of their life. However, one experience doesn't necessarily make it a disorder, but how it's pervasive and then continues and recurs and tends to affect the person's functionality, that's when it begins to move to the realm of a disorder. And even with that, there are diagnostic criteria we look at: duration, the symptoms, and amongst others, before concluding that an individual has these anxiety disorders. So there are lots of interventions available that help individuals who are experiencing these disorders to improve and get well. And the aim is to have a great standard of living as much as possible. For those who are able to go into remission, that's great, but there are a good percentage that might live with it for quite a period of time. I will just add on that. So, as we said earlier, it might be during childhood, adulthood, but even in the elderly years, some people still experience these disorders. It may be a bit peculiar during that period, but at all levels, the aim is to get persons to be the best they can handling these situations. Yes. So there are different modalities that we kind of put together or use when managing individuals who are experiencing these anxiety disorders. The core management we focus on is what we call the psychotherapy. Some people would say talk therapy. So it tends to be with a trained clinical psychologist who would assess the individual of the particular anxiety disorder, and then outline the therapy modalities for the individual. And there are different types that might be used considering the specific type of anxiety disorder. So when necessary, other interventions like medications or pharmacotherapy might also be used. We talked about a lot of these physical symptoms, palpitations, breathlessness. So the whole phenomenon can be quite intense. And so sometimes some medications might be used to help ameliorate these as well. And sometimes together, pharmacotherapy and psychotherapy come together to help give the optimum outcome. So yeah, so there are different measures we use that we put in play when managing anxiety disorders. Not everyone might even seek medical intervention, especially when it's mild, and especially when it's in the case where the feared or dreaded entity or circumstance is avoidable without impacting the person's life so much, or something the person doesn't necessarily encounter frequently. So, for example, if my specific phobia is of, diving use, let's say heights, but then my work does not involve heights at all. And so I just go to the hospital, come home. I hardly ever go up. My clinic is ground floor. Then in that case, it doesn't really impact my functioning. So I'm able to work without necessarily even needing much medical attention. But if, for example, I were working as someone with the Electricity Company of Ghana, and my work was to be climbing or mounting up these high structures, then and it begins to impair my ability to work and function, then I would need intervention. So based on the level of acute impact someone's life, then it will even determine the person needs intervention in the first place. But then for those who start into therapy or who get intervention, there are very good outcomes that are seen as well. And some people actually have the symptoms remitting completely. There are a few, however, who might still need help along the line. So it's kind of case by case, but there are good outcomes. There are good outcomes. I think for that, the significant thing to mention is the whole COVID period that came up. That in itself kind of gave a fertile ground for anyone experiencing this to kind of have it heightened, because generally it's increased anxiety amongst most persons. And so with that background, then these disorders kind of just get escalated a bit more. Thankfully, things seem to be a bit better in our locality, but in other settings, it's not as great as it is here yet. So we still have a lot of these issues being significant in other societies. So there, especially the COVID, the predominant mental disorders that were noted to kind of be a bit increased were the depressive disorders and the anxiety disorders. Those are a bit on the higher side here. So this can be perceived from different aspects. So for the individual who might be experiencing this, one, it's just good to know you are not alone. Okay, anxiety disorders are the most common mental health disorders worldwide, and these, as we've explained, based on the severity, can really impact one's functioning. So it's not peculiar to just you if you are experiencing any of these. The sad part is that though it's the most common, majority of people do not get help for it, because majority of people do not even know that there's help for it. So it's very important knowing that this is a disorder, so that you can actually reach out and get the help you need. So you don't necessarily have to live below your optimum, because you think there's nothing that can be done. You can reach out, you don't necessarily have to even go to a mental health institution. Visit your GP in a general practice, mention the exact symptoms, and get a thorough workup for sometimes some medical conditions might have symptoms mimicking this as well. So once you get a thorough, clean slate for all of these medical conditions, and we are very sure an anxiety disorder, then you can get the requisite help. Now for family, for friends, for colleagues, for other people aside the individual who might be experiencing it, it's really important to know this, because one, we are a society, so you're not an island. You have people around you, and how what happens to one person affects you. If you're looking at a professional entity, yes, you're concerned about your colleagues or your employees, their health, but also their health kind of impacts productivity as well. So once an individual is experiencing these disorders and it's taking a toll on their productivity, it doesn't make them a bad employee. It just means that they are someone who needs help to be able to bring out their best and to shine as they are meant to. So by understanding these one, we kind of better respond when we observe these things and are able to link them to the institutions that can help the individual get better. For families, sometimes, we talk about different types, but essentially it might even affect how an individual is able to relate to other people. Okay, we are talking about social anxiety amongst others. All of these, once you understand this better, one, you can better understand the individual, less of blame game, less of name calling, which all leads to a strained relationship and it doesn't help the situation any better. Once we understand these, we are able to rather rally around the individual and help them get better so they can live life to the best of their abilities. Yes. So there are, as we keep saying, lumping together makes it a bit difficult. But generally, considering how most of them manifest, it's not really something that is, how do I say it, that is easily preventable by the nature of its presentation or how it occurs. So we talked about, yes, the genetic component, that is a bit difficult to avoid. But in the environmental circumstances, yes, there are some things we can do. So for things like the home environment, talking about adverse experiences during childhood amongst others, yes, so there are some things we can do to a good extent, okay? So physical abuse, emotional abuse, sexual abuse, once you're able to put in interventions to reduce the likelihood of this affecting our children, we kind of helping with that aspect. But then things like how people experience some stress or some triggers, most of these you can't really foresee. So it's difficult to kind of avoid those aspects. So the bits we can do, yes, we'll do, but then essentially you can't say you're avoiding the entire, you're preventing the entire condition because there are different factors that come into play. You can do the bits you can. However, I think what we can emphasize on is the fact that once we notice any of these symptoms coming up early, putting in measures quickly to get individuals better would help get a better outcome. One, I would like to start with saying that physical exercise doesn't not help generally. Okay, so it's always good to stay fit. But then it would not say it might have a role, but it's not necessarily high up there when we're looking at interventions for this. For some people who have panic disorders, amongst others, they might actually on their own avoid some things like exercise, amongst others, thinking that it triggers these episodes. So they might avoid it. So in therapy, then the aim will be to work towards them being able to re-engage with these other things that they're avoiding because of the condition. So physical exercise, yes, helps the body, but then for this condition in particular, it's not, let's say, high up there that it's going to be preventive of the condition or used in therapy of the condition. I'm hoping I'm making myself a bit clear. Yeah. So the therapy involves different aspects, but one of the key things is relaxation techniques. So as you said, one gets excited, one gets anxious, and in that space, you have to learn how to calm down, okay, and relax. So these relaxation techniques are taught, and so that anyone knows how to calm and relax themselves. And there are different types of or modalities by which we introduce the stimulus or the thing that kind of generates that anxiety. So there are some cases where an individual will just be exposed suddenly, so kind of like essentially like flooding the person with that particular thing that might be inducing the anxiety. And there are circumstances where we might actually do a graded exposure. So you might not necessarily need and be exposed to the full thing itself, but maybe sometimes if, for example, the person's specific phobia is maybe a spider, you might start off with maybe some pictures of it and then move into a rubber toy version of it before I move towards like the actual thing. So it's like an graded sense. And with each level, when you experience it, using that relaxation technique to kind of get yourself calmed down and then moving on. So these are very important. The relaxation techniques, among others, are extremely important in management of these conditions. Yeah. There are a lot of things that happen that we quickly tag people and name them and tease or maybe laugh at. But then these are things that for which they can actually get help and might need help for. And it can be quite severe. For some, there are cases where someone, has this whole anxiety about going far, distances. So the person would essentially seek work just close to home because they can't go that distance. For some cases, even just use of public transport becomes such a difficulty. So if the person doesn't have a vehicle of their own, you can imagine the distress they might have to do walking long distances just because they can't bear the anxiety of using a public transportation. And you might call the person all kinds of names. Meanwhile, they are actually experiencing these intense feelings. And there have been some university students we've seen who've had these panic attacks, and when it's happening, it's a bit florid, the person is free, like can't breathe, is struggling for breath. It looks very, and people can get all kinds of perceptions or ideas about the individual, and then that kind of just worsens the whole scenario. And most people with these anxiety disorders sometimes are actually even afraid of being termed crazy, being termed actually losing their mind. All of those are fears and the worries the individual is having. And as I said earlier, some of the conditions like the panic disorder, the specific phobias have some association or link with increased rates of suicide as well. Okay, so all of these things are necessary for us to just know about. So if you notice something peculiar about individual, asking or talking to them about it helps. And then if necessary, we can link up with health services to get the help they need because these can be managed. Imagine a young man having to avoid talking to young ladies because he has social anxiety and he just fears being scrutinized. So you want to have a relationship, but just that anxiety you experience talking to a new unfamiliar person kind of hinders such a person. It can lead to other conditions. I would say there are comorbidities. So sometimes comorbid with depression, you have comorbid with some substance use disorder, among others as well.